In general, meta-analysis is a statistical analysis that combines the results of multiple studies and address the same question. Systemic review is a systematic and explicit method to identify, select, and critically appraise relevant research and collect and analyze from the study that are included in the review. Randomized controlled trial. It is a group of patients are randomized to either receive or not to receive the treatment, and the outcome are compared in a prospective manner. Regarding cohort study, this is the best scientific method for measuring the effect of a suspected risk factor. They can be prospective cohort study. The researcher raises a question and form a hypothesis about what might be a cause of disease. Then they observe the group of people known as cohort over a period of time, and this may take several years. The problem with cohort studies is very lengthy, expensive, and difficult in examining rare disease where the incidence is low and there is no randomization done. Case control studies, a study where individuals with a certain outcome are compared with individuals without the outcome. So there is cases and there is a control. It's a retrospective analysis of exposure. These studies are quick and cheap to perform, and if constructed carefully, can yield good information. Case series. If the case is reported, that is published. And then last come the expert opinion, who give the opinion regarding a study.